If you've been trying to get pregnant, you may or may not have heard of the term implantation bleed. You may also be wondering what the heck it is, what it means, and how it differs from your regular cycle bleed. Let's take a couple minutes to break it down. It can be really easy when we are in our 2-week wait to overanalyze and or get hung up on having or not having a particular symptom to tell us whether or not we are likely going to get pregnant that cycle. I completely understand why it happens, and I have been totally guilty of it myself, but it's hard because it's something that you want so incredibly badly. So what is implantation bleeding? It actually only occurs in about 30% of women, yet it's one of the symptoms that is so heavily talked about, but it's actually not that common for women to get it. Yes, it can be an early sign of pregnancy, but lots of women will go on and get pregnant that cycle and not have had any implantation bleeding at all. Typically, it's very light bleeding, something that you may only notice when you utilize the washroom and are wiping. It's definitely not an amount of blood that would require a tampon or a pad of any kind. It also tends to be a very light pink in color. You shouldn't notice any clots if you get implantation bleed, and it should only last about 1 to 2 days. Because typically implantation happens 7 to 10 days after ovulation, it's in and around that mark as to when you may or may not notice the implantation bleed. Now let's differentiate this from your normal cycle bleed. Your normal cycle bleed will be what your normal cycle bleed is, meaning if you're normally a 3-day flow, that's what will happen. 4 days, 5 days, whatever your typical cycle length is, that bleed will last that amount of time. A period bleed doesn't tend to be light pink in color. It's usually bright red or dark red. Depending on how heavy your flow is, this is when you may or may not see clots. And again, if you have a moderate flow, you may never see clots, which is totally fine. If you have a really heavy period, you may see clots. That's also totally normal. Spotting before your cycle or your first day of bleed can be common for some women. It can also be linked to lower progesterone levels. So depending on where you are in your fertility journey, if you haven't had your progesterone levels tested 7 days post-ovulation, it may be a good opportunity to have that conversation with your naturopathic doctor or your family doctor to see if they think it's something worth investigating. Testing your progesterone levels 7 days post-ovulation gives us 2 tidbits of information. 1, did you in fact ovulate this month? And 2, are you producing enough progesterone in order to maintain a pregnancy? Follow along for more fertility tips.